this time. Real quick, the number of cases now has risen to 225 total. The latest 9 are all local transmissions. Is that a cause for worry?
Yes, Jeff, just as you've been fast, thank you very much for having me. And as you've heard the Cabinet Secretary repeatedly say, it worries us that the transmissions that we currently have are not of people who have just recently traveled from out of the country. What we are seeing is that corona is now within us, it's within the communities. You've also seen the spread into the counties, which really demonstrates to you that we have moved from one step to another level where there is now community transmission, and that really needs to worry us a lot.
Yeah, which begs the question now, PS, are the counties ready?
Well, Jeff, we have been working very closely with the counties in terms of, the preparedness for managing the pandemic. And there are several activities that we have done, including identifying facilities where patients can be treated. And we are now in the process of supporting them to have those facilities well equipped. But I must also recognize that under the Managed Equipment Services, the MES program, you'll actually find we have got quite impressive capacity within the country. Because in the 15 counties where we have got theaters, for example, we have about 10 ventilators in each of those hospitals. In the 54 places where we have got the renal units, each of them has got an oxygen concentrator, 2 patient monitors. So you can see that our level of preparedness, we are not starting at ground zero. And I'm sure you heard the chair of Council of Governors recognizing that presently there is some capacity, but of course we are working very hard to increase it. And Jeff, also we must recognize that there is generally a disruption of the global supply chain for health commodities following this outbreak. And so, we are basically expanding capacity as we get access of more and more equipment that we need. But that's on the equipment side. In terms of the PPEs, we've also just been moving that way. And Jeff, I think you've heard us say in earlier press conferences and meetings that PPEs are actually quite an expensive investment. When you talk about kitting a health worker from bottom to toe, you're talking about an investment of about 15 to 20,000 shillings. And you're talking about one patient using almost 5 pieces of PPE because they are being handled by different health workers in a facility. So one of the things that we have made sure has happened is that in every place where we have had a reported case of COVID, there has been PPEs provided. We have given on the basis of the level of cases that exist in a county. We have ensured that we have provided the testing kits as well, the sample collection kits. So we are pretty prepared. And, we also should recognize that we are just 1 month into Corona, and you can imagine having to mobilize the kind of resources that we require to tackle it, considering the contagious nature and the highly infectious nature that it has. I would say that we are now at a good place, and particularly so because the local manufacturers have now the capacity to have our own PPEs made here and to the standards that are acceptable to the health workers.
Okay, let me ask you this. I read somewhere that about 800 people were tested today. Is this part of the mass testing that the ministry has been talking about?
Yes, you would say that, because really what we started off was, one, we said that all the frontline workers, you've heard the minister, really weigh in on this and say that we must test all our health workers. So a good number of that comes from the health workers that we have begun to test, and will continue to test in the coming days so that we are comfortable that we have basically ascertained that all of them are okay, and for those that are not well, to begin receiving treatment. And the numbers also include those that have we have contact traced, because as you see the cases coming up, there is so much work that is going on behind the scenes in terms of tracing people who have been in contact with individuals that have had corona. So work is going on. All those people we are getting, and you can imagine for one person, you may find that they were in contact to between 5 and 30 people. So you can imagine that, there are teams that must follow that chain backward and make sure that all those people are tested. So,
okay, and when should we expect the mass testing in the counties, PS? Is it Nairobi, Mombasa, Kuala, Mandera? When should we expect that mass testing?
What we are going to be doing, actually, again, if you followed what the Cabinet Secretary said today, we are going to focus on, say, for example, Mombasa. We have a problem at KPA. It's clearly a hotspot. So that the testing has already begun, and we will test every worker at KPA, and Mombasa County government is on top of that. Mandera, we send them test kits over the weekend, and we send them sufficient PPEs, and their level of preparedness actually is very impressive, because they have already designated their Mandera Referral County Hospital as a COVID treatment center. So we will move continuously targeting the areas and the people who have been exposed. So that is the kind of testing that we are presently focusing on.
All right, Susan Mochache, I know you're busy at work. Thanks so much for your time. We appreciate it. We'll keep in touch.
Thank you very much,
all right.
Jeff.
The Health Principal Secretary, Susan Mochache, there giving us an update on coronavirus numbers and also mass testing. We're going to take a quick break, come back. There's still plenty more ahead. And also, Nairobi Senator Johnson Sakaja standing by with the bill I talked to you about, PRM, Pandemic Rescue and Management Bill, currently being debated in the Senate. We'll talk about that when we come back. Keep tweeting at Koinanga Jeff, at Citizen TV Kenya. The hashtag is JKLIVE. JKLIVE takes a break. We'll be back in a moment.